Hello everyone, this commercial is about Olodaterol. This is what the drug looks like, and we will also be simultaneously handing out brochures that has all the general information required for your understanding of Olodaterol. Olodaterol is also known as a bronchodilator. It works by relaxing the muscles around the airways so they open up and you can breathe more easily, controlling symptoms such as breathing problems. Olodaterol is used for the long-term maintenance treatment of airflow blockage in patients with chronic obstructive pulmonary disease, including chronic bronchitis and emphysema. It belongs to a family of medicines known as the adrenergic bronchodilators. Here are a few more examples of how Olodaterol is used. Olodaterol inhalation comes as a solution to inhaled by mouth using a special inhaler. It is also used to control wheezing, shortness of breath, coughing, and chest tightness caused by chronic obstructive pulmonary disease, also known as COPD. Please read our instructions carefully before using this. The instructions are fairly simple. We will need you to use the inhaler once a day. Each time you use it, take 2 puffs. Olodaterol. It's indicated for maintenance bronchodilator treatment in patients with COPD, including chronic bronchitis and/or emphysema who are experiencing airflow obstruction. It should not exceed 2 inhalations every 24 hours. Proper administration. Prior to the first use case, cartridge containing the Olodaterol solution is inserted into the Respimat inhaler and the unit is primed. If not used in over 3 days, patients are to actuate the inhaler once to prepare the inhaler for use. If inhaler has not been used in over 21 days, patients are to actuate the inhaler until an aerosol cloud is visible and then repeat the process 3 more times to prepare the inhaler for use. How to use it. First you turn, keep the cap closed, turn the clear base in the direction of the arrows on the label until it clicks. Then open the cap until it snaps fully open. Next, press, breathe out slowly and fully. Close your lips around the mouthpiece without covering the air vents. Point your inhaler to the back of your throat. While taking a slow, deep breath through your mouth, press the dose release button and continue to breathe in slowly for as long as comfortable. Hold your breath for 10 seconds or for as long as comfortable. Repeat, turn, open, press for a total of 2 puffs. Close the cap until you use your inhaler again. If you miss a dose, use it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Use your next dose at the regular time. Do not double the dose to catch up. The following conditions are contraindicated with this drug. Check with your physician if you have any of the following conditions. Drugs that are interacted with Olodaterol. Use this medicine only as directed by your doctor. Do not use more of it and do not use it more often than your doctor ordered. Also, do not stop using this medicine or any asthma medicine without telling your doctor. To do so may increase the chance of breathing problems, and here are listed some of the drugs that Olodaterol is interacted with. Here are the links of the sources we use to deliver this infomercial to you today. Also, the brochure we passed out is easy to read and tell you the most important facts that you should be made aware of regarding Olodaterol. Thank you guys so much for giving us your time to listen in and learn more about Olodaterol, and we hope following this infomercial you are leaving here more educated on Olodaterol than you were when you came in. Thank you so much again.